Hello and welcome to The Virus. I'm Jeremy Fernandez. As the Northern Hemisphere heads into winter, COVID-19 case numbers there are surging again. Researchers and infectious diseases experts are tracking a slew of variants from the Omicron family tree, coinciding with looser restrictions and the colder weather. One thing Australia's got going for it, though, is that we're of course heading into summer. So what are the chances the European surge will reach us? Associate Professor Stephen Griffin is a virologist at the School of Medicine at the University of Leeds in the UK. Dr. Griffin, thanks for joining us.
It's a pleasure. Thanks, Jeremy.
Cases in the UK are surging. What's your reading of why that is?
Well, it's mainly behaviourally driven, mixed in with waning immunity. So, we've had several waves this year in the UK, sometimes of different variants of the virus, but this is probably mainly driven by the same virus that was resurgent in June, but along with a sort of soup of other ones that are sort of derived from it. And it's mainly because we're not in a static situation with this virus. Our immunity is waning in general as a population, and the virus is changing and getting better at avoiding that. So as we change our behaviour, as we go back to school, as we go back to university, as we go back to work after our holidays, again, and actually the last wave didn't really bottom out at all. It stayed at a very high plateau. It's now coming back, mainly because of behaviour and waning immunity.
So how far is this likely to go? Is this a localised blip or is this the start of a new global wave?
Well, I think it's really hard to compare the dynamics of how waves move across different countries nowadays because the immunity profiles within those countries are vastly different. The vaccination programs in those countries are vastly different. So, the UK has its own vaccination policy. We're primarily targeting clinically vulnerable people and older people, but that's not going to limit transmission. And unfortunately, we're seeing another resurgence in cases. It will almost certainly happen across the globe because these things are being detected. These new variants are being detected across the planet at the moment in different places. So America, Europe, Canada, and of course here in the UK. And I don't imagine it'll be too long before it makes it down to Australia.
Even though we're heading into summer and you're heading into winter, how much is this a seasonal issue?
Well, if it's seasonal, then the UK have had 4 winters this year. Okay, so it's mainly to do with how incredibly infectious and evasive these viruses are, combined with people's behaviour. So we really haven't got any protections or mitigations in place in the UK now, after February when the government just dropped them. And so people's behaviour directly affects the dynamics of that transmission rate. So yes, in winter, you're more likely to spend more time indoors. We spend a lot of our time indoors. You're more likely to not open the windows. You're more likely to interact with people in social events, for example. That is why seasonal viruses tend to have that seasonality to them. Difference is with something like influenza that we see seasonally, that it doesn't change as quickly. And so we can predict what the vaccine should look like. We can predict where it's going to turn up and we can act accordingly. For SARS-CoV-2, it's changing so quickly and we're seeing this rapid emergence of new viral variants, and our vaccination program is frankly out of date. And even the new bivalent vaccines that we have are starting to become out of date because we're always behind. And that's why myself and colleagues favour a vaccines plus approach. You can't keep up with this virus by just vaccinating. You have to suppress the levels of transmission because that's what generates diversity.
How much of a risk do the variants still pose?
Well, at the moment, it's very interesting. So previously, we've had sort of sequential dominant strains of the virus. So we had BA1 last Christmas and followed by BA2, and then BA4-5 was the one that hit us in summer. BA5 is still very much very common, and it's coming back because we're not all immune to it and it didn't infect everybody. But there are sort of derivatives of those viruses that are changing. And it's very interesting because as opposed to just having one, there are multiple different forms of the virus, which all seem to be adapting in a very similar way to avoid our immune responses. And they all have their own unique properties and they're geographically in different places as well. So it's really difficult to understand which one of those might cause the sort of dominant wave. It could be that they all act together, actually. And so that, again, is really hard to deal with. But frankly, this virus is so good at reinfecting us that if we continue to behave in a high-risk fashion, it will come back. And even though we are a highly immune population, as our immunity wanes and the virus changes, the risk of something going wrong increases over time, and the risk to higher risk groups increases over time. And it's absolutely a dreadful consequence of allowing things to go unchecked, that clinically vulnerable people still remain effectively under what you might call a lockdown. And that, for me, is socially just amoral.
So in the event of few restrictions that we've got now, how effective are our next best lines of defence? Things like vaccinations, masks, physical distancing?
Well, this is it. So, the stringent measures of lockdowns and things shouldn't really have ever been necessary beyond the first one, because we understand how this virus spreads and we understand how to limit the high risk transmission. Okay, so masks, yes, are important if you're in a poorly ventilated space, okay, and with lots of other people, because it's ventilation. This virus is primarily aerosol spread. So if we can spend more time outside, we can improve the ventilation and cleanliness of the air in our buildings and in our public transport, then in those high situations, you don't have to have personal mitigations or risk avoidance mechanisms, because what we should be doing is thinking about it on a population scale. And I think that's the real problem with some of the focus of governments, including the UK, where what they've tried to do is put the emphasis on a personal risk. I've not met this person who's had severe COVID. I've not done this and that. But I crossed the road this morning and I'm aware that somewhere someone got knocked down. Okay, so that's the government's role, should be to provide that safety net of public health, to improve our ventilation, to improve vaccination, to improve those circumstances around which we can continue much more as normal. But the problem is that they seem to be favouring personal choice, personal freedoms over that. And that is not responsible public health, in my view.
There is less and less data being collected. There's much less surveillance of COVID-19. What effect is that having? Well,
it blinds us. A good friend of mine said it's like looking in the rearview mirror to try and drive at night. It's really hard. So we have a gold standard survey in the UK, the ONS survey, which is not biased. So it's a population-wide survey. That's been scaled back. So we're losing the granularity of that data. We also aren't getting the number of sequences from the data, because people aren't doing PCR tests anymore. And so that really is making it a lot harder for the sort of central intelligence people that are looking at the variants, looking at the evolution, looking at the rate of spread. But it's very clear the hospitalizations are going up in the UK as well, as does every time. And I think we're becoming a little bit desensitized to that.
Dr. Stephen Griffin, thanks for joining us.
Thanks, Jeremy.
While genomic surveillance of variants is not taking place to the same extent it used to, authorities in many countries are nevertheless concerned about new variants that are spreading quickly. That's got implications for how we go about our lives and how effectively our vaccination regime holds up. Associate Professor Sanjaya Senanayake is an infectious diseases physician and lecturer at ANU. Dr. Senanayake, great to have you with us. Thank you for being here.
Great to be here, Jamie.
Now, how concerned should we be about these new variants and related surges reaching from other parts of the world back into Australia?
Well, it's different to March 2020 when Australia's borders were closed. Whatever is found in other parts of the world will reach Australia because of global air travel. I mean, you just look at the queues on the news at all the airports. So global travel means that variants will travel too. Should we worry about it? At the moment, the types of variants we're seeing, they're Omicron subtypes, particularly subtypes of BA2 and BA5. It was interesting early on when BA5 and BA4 were around, we were worried that BA1 and BA2, our immunity from that wouldn't protect us at all. But a really nice study came out from Portugal in the New England Journal of Medicine, showed that if you've had BA1 or BA2, you've got 75% protective efficacy against getting BA5. And even going back to the Wuhan virus, that gave you about 50%. So it is still likely that we will get protection from having had an Omicron infection before with these new subvariants. And of course, take into account the fact that we've had the vaccines too, and we're a highly vaccinated nation. That will also help.
How much does heading into summer for us help?
Certainly, we saw a big surge in summer last year because of Omicron, this new variant that appeared. But in many ways, this is acting like a winter virus. And we are seeing, as the warmer weather comes, there are cases that are dropping on a background of having this hybrid immunity, people having had both vaccines and infections. So hopefully we should be fine if we don't see something too different in terms of a mutation reaching Australia.
This time next week, isolation will no longer be mandatory for people who are asymptomatic. It's not something that's strongly policed anyway. What impact is that going to have on our daily case numbers?
Look, hopefully not too much, because if you think about it, for the last month, we've been having a 5-day mandatory isolation, having gone down from 7, and we didn't see a surge in cases. And part of the background to that is already there was a significant proportion of people who would have been infectious in the community with COVID, not because they deliberately went out of their way to do so, but because we estimate anywhere from 30 to 50% of Omicron cases are asymptomatic. And on top of that, we've got that hybrid immunity, people being infected before and being vaccinated.
We've heard Dr. Stephen Griffin talk about the lack of data in the UK to point out where things are headed. What about here in Australia? How comprehensive is the genomic sequencing?
Look, as a nation, we're very good at genomic sequencing. Right now, there wouldn't be an enormous amount because of the dwindling cases, but certainly if there's a surge, we've got the ability to ramp up our genomic surveillance. One difference, of course, is we are getting a proportion of our test results from rapid antigen tests where you can't do genomic sequencing, but we'll still be getting the PCR data that we need to do so.
As we heard from Dr. Griffin, things change from country to country depending on the vaccination regime. How well is our vaccination regime holding up to all of this?
We're doing very well. We've got a big proportion of the population, enormous proportion, who've had 2 doses. Slightly less have had a booster, and we've had another smaller proportion who've had 2 boosters. And we know that, in fact, even 2 doses of the pre-Omicron vaccines still give you reasonable protection against severe disease, and that increases more and more with a first booster and a second booster.
What is your outlook for the next few months heading into next year as we loosen restrictions right across Australia?
I think as long as a new variant, a pi or a rho or a sigma, doesn't suddenly appear, with our summer weather, with our hybrid immunity, we should hopefully continue that transition from pandemic to endemic, but we're still not there.
Dr. Sanjay Senanayake, great to have you with us. Thank you.
Thank you, Jeremy.
And that is the show for this week. Join us every Friday at this time. For now, goodbye.